People come to us with questions about treatment of a heart attack. Often you can break those questions down into two categories. The first category is often diagnosis, meaning did a doctor or hospital correctly diagnose a heart attack? A general standard that's true in almost all situations involving possible heart attack is that if there are any symptoms suggesting even the possibility of a heart attack, they need to be ruled out right away. Now, in typical cases, heart attacks present with classic symptoms such as pressure on the chest pain, left-sided jaw pain, often left-sided arm pain. In cases like that, it's often very easy for doctors to make the diagnosis. In other situations, the symptoms are not necessarily, quote, typical. However, when there's any consideration of even potential for heart attack, it is a medical standard that doctors are supposed to consider that and rule it out right away, just because of the moment-to-moment urgency of the situation. A second category of questions also involves treatment, such as a person comes to a hospital and pretty much right away they have a sense or diagnosis that this is a heart attack. However, for some reason, the care is just not delivered in a timely way. There are standards put out by all the respected organizations, notably the American Heart Association and American College of Cardiology, that have established some pretty firm benchmarks of care. And when you put it all together, those benchmarks call for an overall standard that from the time a person hits the door of a hospital with any symptoms of a heart attack, they should be getting treatment in the form of an actual intervention by catheter to the heart within 90 minutes. Now, there are some cases where that doesn't always happen, but if there's a situation where someone has a heart attack, goes to a hospital, and that kind of care is not delivered in that 90-minute guideline standard, it often raises serious questions whether there was appropriate care. If you have any questions about whether you or somebody you know was properly treated for a heart attack, either in diagnosis or treatment, please give us a call and we'd be happy to answer your questions. You can also text us through the website or fill out the contact form on our website. I hope this is helpful. Thank you for listening.